Thank you, and thank you, Rabi, for the invitation. And I will start with the beginning, that means the sonoembryology of the fetal brain and what we can see with the ultrasound. First method, we can use 2D ultrasound, but when you use 2D ultrasound, you have to move to sweep inside the embryo. And also we can use a 3D ultrasound. The main advantage of 3D ultrasound, you can save a complete volume of the embryo, and after you can cut inside, you can do a multiplanar omniview, TUI. And also you will see in my lecture lots of 3D rendering, and especially that one here, with this transparency mode, the name is a silhouette, we can see the liquid part inside the brain. And also you will see some picture made with inversion and with a sono AVC. But first, if you want to study the embryo, you have to forget the abdominal way, because it's not possible to obtain a nice view of embryo around 20-25 millimeter. And this is the same embryo, and this was made with an abdominal probe, and the same with transvaginal probe. And the main difference will be with if you try to do a section inside the volume. This is really more clear than this one. Also, we are using filtering, because if you move inside a 3D volume, if you try to do a 2D section inside, this is a kind of raw data, and this is after filtering. So all the picture, we have to use different level of filtering. And this is the development of the embryos. It's around 21 days from fertilization date. That means it's exactly 5 weeks from last period. And this is what you learn, but don't expect to see something at that stage of pregnancy, because 5 weeks of pregnancy from last period, this is what you can see. You can see the trophoblastic ring, the yolk sac, but it's not possible to see the embryo. The embryo, you can see it only after 6 weeks of pregnancy. First, you can see the embryo, you can see the heart beating. Sometimes you cannot do the measurement of the embryo. And just few days after, it's possible to do the measurement. And at that point, the embryo, 6 weeks of pregnancy, you have the stage of 4 vesicles. You have the prosencephalon, mesencephalon, and rhombencephalon with a cavity on each part. And 1 week later, you have the stage of 5 vesicles. That means you have 2 lateral ventricules, the 3rd ventricle, the aqueduct mesencephalic, and the 4th ventricle. And the rhombencephalon will give 2 parts. The upper part is the metencephalon, and the lower part is the mielencephalon. And the prosencephalon will give the telencephalon, that means the lateral ventricle and the hemisphere, and the diencephalon, the central part. But what I like to do is to study the embryo, but always I start at 8 weeks of pregnancy, because 8 weeks of pregnancy, already you can see the different, you can see something inside the brain, the liquid part. And this is inside the 3D volume. What we use, we are using the omniview. That means we draw on this sagittal plane, and you have exactly the different part of the brain. We flatten this, and you can recognize the rhombencephalon, the mesencephalon, the diencephalon, and the telencephalon with the 2 lateral ventricles. And the mesencephalon, this part is large at the beginning also, but it will give the aqueduct. And with this silhouette, it's really more easy to understand. You can see, so again, the posterior part, the rhombencephalon, this is the biggest one, and the diencephalon, the mesencephalon, and here the 2 lateral ventricules. And here, what you can see here, it's not a part of the lateral ventricle, it's only the pericerebral space you can see here, and it's quite important at this stage of pregnancy. And this is another 8-week embryo. That means it's 15 millimeters of chromolank length. This is a section inside the volume and 2 different random modes. And you can fly through this embryo and see the different parts. But on the screen, it looks large, but imagine it's only 15 millimeters, and the size of this part is only 2 millimeters. It's just to show you how important is the accuracy of the picture with the transvaginal probe. And this is the upper part of the brain. We move inside the 2 lateral ventricules. the mesencephalon, the diencephalon is lower, and when you move on the posterior part, you will see here the biggest cavity, the rhombencephalon. So to summarize, at 8 weeks of pregnancy, if you look at the sagittal view, you can see the three parts. That means the rhombencephalon on the posterior part, the mesencephalon and the diencephalon. If you go to the coronal view, it looks like an anchor. You can see the diencephalon and the telencephalon giving the two lateral ventricles. And this is the axial view with the rhombencephalon on the posterior part and here the two lateral ventricles. And at 8 weeks of pregnancy, just before 9 weeks of pregnancy, what will happen, you will have a flexure of this part. This is a brain stem, and you will see it later. Now we move to 9 weeks of pregnancy. What happened on the brain at 9 weeks of pregnancy? You have an important development of the hemisphere and the lateral ventricle, and it's already possible to see the choroid plexus inside. And if you look at the sagittal view, you have a folding, there is a flexure of the rhombencephalon, and the rhombencephalon will give two parts. And this here, we move inside the volume, we go on the upper part, on the axial view, with the two lateral ventricles, the choroid plexus. This is the diencephalon, this is the mesencephalon, and the mesencephalon is still large. And here, what you can see, it is the pericerebral space. The ventricles stop here. And with the silhouette, it's more easy to understand. So you can see the two lateral ventricles, and this is the rhombencephalon. But what you can see, it's not really the brain when you have such a picture. It's only the liquid part of the brain. The brain develops around. And 9 weeks of pregnancy, so you can see here the folding of the rhombencephalon, and the upper part, we will see it later, will give the fourth ventricle. And if you look at this during 10 days, that means it's from 7.5 weeks to 9 weeks, the development of the brain cavity on the sagittal plane, and this is a rhombencephalon. And what you can see, it's a transformation of the rhombencephalon, but if you take this distance, it's still the same from 7.5 weeks to 9 weeks, and there is only a flexure of the rhombencephalon. 10 weeks of pregnancy, and I will stop at 10 weeks of pregnancy because 10 weeks of pregnancy, that means the crown rump length is 32 millimeters, and this is the end of the embryonic part. After, it's a fetus. But you can see, again, important development of the lateral ventricle with the choroid plexus inside. And if you look at the sagittal view here, you can already see different parts here. And the first, you can see all the liquid part. This is the lateral ventricle, and that means we are not exactly on the sagittal, but it's really difficult because it's small. We are not mid-sagittal. This is the third ventricle. This is the aqueduct mesencephalic, and this is the upper part of the rhombencephalon, but now it will give the fourth ventricle, and this is the cisterna magna, and you can see the brainstem and the flexure of the pons, the choroid plexus of the lateral ventricle, the choroid plexus of the fourth ventricle, and this is a part where the cerebellum will develop. And you can compare here the development of the brain cavity from 7 to 10 weeks of pregnancy with the important development of the ventricle. And what is strange, at the beginning of pregnancy, the rhombencephalon is the biggest cavity inside the brain, and it will give the fourth ventricle, and after it will be the smallest cavity inside the brain. Why is it important to know this anatomy? Because already if you do an early scan, it's possible to see and to find some malformation. What is it? Acrania, anencephaly, exencephaly. And you can see there is an irregular shape of the head. You have no brain cavities. And you have many type of acrania, anencephaly, exencephaly. Sometimes the brain is completely outside. Sometimes there is a defect only on the posterior part. And this one was made at 8 weeks. The chondrum length was only 15 millimeter. And this was a 3D. And I remember when we did the termination of pregnancy, because this was really severe, we did it at around 1 week later, 9 weeks of pregnancy. And when I took this picture, it was really difficult for me to take this picture because it was only less than 2 centimeters. And it's more easy for me to work on my ultrasound system because I can magnify and it's more easy. Allobar holoprosencephaly, if you have a allobar holoprosencephaly, already it exists on the early stage of pregnancy, but it's difficult to see. First, if you look at this embryo, you can see you have an early hydrothorax. That means this is a poor prognosis. But if you look at the anterior part here, you have only one single ventricle. And this was this case. You can compare with a normal one. Already at 8 weeks, 9 weeks, you have 2 frontal horn here. And this is a 3D. And you can compare with the normal, with the 2 lateral ventricles. In this case, with only one single frontal ventricle. So what is this? This, you saw it earlier. It's a pericerebral space. It's not a part of the ventricle. And in case of holoprosencephaly, because you have a small anterior part of the brain, you have a large pericerebral space. So this is not a part of the lateral ventricle. And spina bifida, this was my first case of spina bifida at 8 weeks of pregnancy. First, it was an embryo with other malformation. You can see the heart is, it looks outside, and the position of the hand was abnormal. But if you look at the posterior part, it was irregular, and I did a 3D, and this was a 3D. And first, I thought it's not possible to be a spina bifida because it's huge. And I opened this book of embryonic malformation, and it was exactly the same. And I had other case. This was another case at 9 weeks of pregnancy, spina bifida. It was a low-risk pregnancy, but I did the screening, and you can see the spina bifida here, 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 and with 3D, with different random mode. And because it's quite severe, and she asked for termination of pregnancy, but we did a checkup 1 week later, and this was a checkup made 1 week later. And you can see the spina bifida, but it was more difficult to see it at 10 weeks of pregnancy than at 9 weeks of pregnancy because the size of the spina bifida was the same, but there was a growth of the embryo. And this was this case after termination of pregnancy. And this is a fetus with acrania, and also omphalocele and a spina bifida. It was a trisomy 18. And look at this one. It was 8 weeks of pregnancy. And if you look at the head, there was an acrania, but it was difficult to see because it looked like the conjoined twins, but only one trunk. And if you look at this case, so I did a scan at 8 weeks, another scan at 9 weeks of pregnancy. And if you compare with the acrania you saw just before, it's quite similar. But it was an embryo with a bicephalous embryo, with 2 heads, with 2 acrania. And how to demonstrate it? And I use a 3D, and with a new random mode, you can see all the bony part, and you can see here, you have 2 mandibles. Here. And this was 1 week later, but 1 week later there was a death of the embryo, and you can see the 2 mandibles here, and the 2 maxilla. And this was this embryo, and also, but it was not seen on my volume, it was not a rachis, it was not a spina bifida, or completely open spina bifida, but it was a double spine. And this case, it's a case from Rabi. He showed me this case. you can see here a defect at 9 weeks of pregnancy on the posterior part, and later the diagnostic was a Joubert 14, and you can see here on the posterior fossa. But I asked him, please, do you have a volume made at 8 weeks or 7 weeks of pregnancy? He had one, and I work with this one. If you look at this volume at 7 weeks and 4 days, you have a defect on the anterior part. This is a normal one, so this is a defect. And this is what happened later, and why the defect is in this position at the beginning, and at 12 weeks, it's on the posterior part. Only because during the embryonic part, there is a rotation of the head. That means what is this part will be the occipital part of the head. And this was an embryo at 8 weeks of pregnancy, but it was dead maybe just few hours before my scan, because when the embryo is dead, you have a collapse of the brain vesicle, and 1 or 2 days after, you cannot see the brain vesicle. But this thromboencephalon was completely abnormal. This is a normal shape, and it was long and large. And this, what I did a print, a 3D print of this brain cavities. This one, 9 weeks, I was surprised because the head was quite large. This is normal on the early stage, but it was larger than expected, large compared to the size of the embryo, and you have a large rhombencephalon and short umbilical cord. Here you can see the umbilical cord, and if you do a scan at 8 weeks, 9 weeks, the length of the umbilical cord is roughly equal to the size of the embryo. That means 21 millimeter of chondral length, you expect a 20 millimeter umbilical cord. And this one was 13 millimeter. And also the heartbeat was high. And this was the scan made at 13 weeks of pregnancy with a median cleft lip, hexadactyly, short umbilical cord, absence of ductus, and still high rate for the heartbeat, and it was a trisomy 13. So what is my take-home message? That means you can see the brain structure. It's possible, but only after 7 weeks of pregnancy and only if you use a transvaginal and high-frequency probe. That means you will see the brain at the stage of 5 vesicles. Acrania, allobaroloprosencephaly, and spina bifida can be suspected, but only can be suspected. And if you suspect it, you always have to confirm it 1 or 2 weeks later, and sometimes to do it at 12 weeks of pregnancy. You have to be really cautious. And look at this case. It was a few months ago at 20 millimeter, and you can see the lower part of the rhombencephalon. It's strange because it's thin and long, so I suspect something will happen. And I did the scan at 10 weeks of pregnancy, and you have a large posterior fossa here. But later in the pregnancy, at 12 weeks, it was completely normal. It was a normal, you can see the fourth ventricle and the choroid plexus of the fourth ventricle and the cisterna magna. And this was at 32 weeks of pregnancy, and it was a normal, and the baby was normal at delivery. So I hope I gave you the desire to study and to look at the brain of the embryo, and I thank you for your attention.